Hello everyone, I'm Dr. Sakamoto. Today, I would like to introduce a case of actual spinal cord regenerative therapy at our clinic. The patient is a man in his 60s who had symptoms of cervical disc herniation and lumbar spinal stenosis. The main symptoms were numbness in the hands and intermittent claudication in the legs. The numbness was quite intense, and there were symptoms where the numbness became much stronger when exposed to cold wind. The intermittent claudication was so severe that after walking about 20 to 30 meters, there was numbness in the legs, and the numbness became so strong that the person had to stop and couldn't continue walking. Due to the intense numbness in the hands, this patient underwent cervical disc herniation surgery in 2002. However, the symptoms of hand numbness persisted. In 2011, a second surgery for cervical disc herniation was performed. But even after the second surgery, the numbness in the hands did not improve. For lumbar spinal stenosis, 2 surgeries were performed in 2016 and 2020. As a result, the intermittent claudication was alleviated. However, the lower back pain persisted, and the patient continued to visit the orthopedic outpatient clinic, receiving weekly block injections to monitor the situation. During this time, the patient came across our clinic on YouTube and decided to try regenerative therapy, leading them to visit our clinic. Here's the MRI of this patient's cervical spine. This is the MRI after the surgery. The spinal canal is wide open, and a large hernia has been removed, allowing the spinal cord to pass through cleanly. Despite the spinal cord appearing clear on the MRI, the situation was such that numbness in the hands persisted. Even with detailed examinations such as MRI, there are damages like numbness and muscle weakness that cannot be identified. While protrusions like visible intervertebral discs can be removed through surgery, it's challenging to treat spinal cord injuries that are not apparent in MRI or precise examinations. This patient received actual stem cell administration into the spinal cord. On the 4th day after the administration, the painful numbness in the hands, which persisted despite 2 surgeries, decreased by approximately 30%. By the 6th day, the numbness in the hands and lower back pain were both reduced by half. 3 weeks after the administration, the lower back pain improved by 70%. After 1 month, the numbness in the hands was remarkably reduced by 70%, and the lower back pain was alleviated by 80%. The numbness and lower back pain, which couldn't be relieved through previous surgeries, showed such significant improvement through stem cell administration into the spinal cord. This patient used to take a lot of medication for numbness and pain on a daily basis. However, with regenerative therapy, the pain has reduced to such an extent that a significant reduction in medication was possible. There are spinal cord injuries that cannot be identified even with MRI or detailed examinations. By administering stem cells into the spinal cord, it is possible to regenerate and repair damage to fine nerves. Stem cell regenerative therapy involves a phenomenon known as the homing effect, wherein stem cells automatically migrate to and target areas with damage. In the case of spinal cord treatment, 25 million stem cells are introduced, which travel to the damaged nerve sites, facilitating repair and regeneration. Through this process, we aim to shed light on new treatment possibilities for the lingering effects, such as numbness in the hands, numbness in the legs, and muscle weakness, associated with cervical disc herniation and lumbar spinal stenosis. Today, we discuss stem cell administration into the spinal cord for cervical disc herniation and lumbar spinal stenosis. Thank you very much.